Hi, folks. Good evening, riders. Welcome to another session two of rider safety. This session is about how to handle an unresponsive patient, somebody who has been in that unfortunate incident, and what do you do to manage an unresponsive patient? We have Dhiren from Jumpstart Outdoors. Welcome, Dhiren, and
Hi.
thank you again for hosting the second of the 5 series. Uh, Dhiren, so a quick introduction again about Jumpstart. What do you do? And then we get into the session. And just for everyone who's watching this video is free. You can watch it on Jumpstart Outdoors, Roaring Cycles, Let's Ride YouTube channels. Dhiren, over to you for a quick introduction about Jumpstart Outdoors, and then we get into the session of unresponsive patient.
Great. Thanks, Abhishek. So, hi guys, my name is Dhiren and I'm from Jumpstart Outdoors. I'm a wilderness first responder and I have been learning how to rescue and various aspects of first aid for the last 12 years, and I've been teaching it also for about 10 years now. Currently, I uh, run Jumpstart Outdoors, a part of which is training people in outdoor first aid, wilderness first aid. We also do a lot of adventure travel and CSR based implementation programs. And there are other training programs as well, which we carry out. So today's session is going to be our second session in the ride safety groups of sessions that we had. And we are going to talk a little bit about an unresponsive patient. So let's try to understand. So last time we saw that when we are at a scene of an accident, we look at it from the point of view of how to keep ourselves safe, right? Because that is something that is of primary importance. When you are on a site where somebody has met with an accident, it is quite easy for a second person to meet with an accident, and you don't want that person to be you. And so we saw how we can make sure that we keep ourselves safe. We also saw a video on how a policeman uh, managed, as in was trying to help, but he did not take care of himself and ended up becoming a victim in the accident. And we also saw a skill. We learned a skill last time to see how we can put on surgical gloves and take them off so that our hands are always clean. So today we are going to learn, once we have decided to step inside an accident scene, uh, and if the patient over there is unresponsive, unresponsive being the patient who cannot give us any response. Okay, so we'll take a quick look at what we can do. So when you've done with the scene size up, when you have made sure that the scene is safe for you to enter, the first thing that we need to do is we need to go and give as an introduction. Okay, so we need to go and introduce ourselves. So I would go to a patient, I would say, hi, my name is Dhiren. I'm trained in wilderness first aid, or I'm a first aider, or I'm a wilderness first responder. Would you like my help? Okay, and it is always important to do this, because when you are going to offer help to somebody who's probably a stranger, it's always nice to be sure that the person agrees to you touching them or giving them any kind of first aid. Okay, so if you don't, then it could become a legal hassle. Okay, because if I so legally speaking, I cannot touch another person unless I have consent. So to make sure that I have consent, I have to check if this person is responsive. I have to get that response from them. So I'm going to show you a video, and we'll try and first assert how to ascertain if the person is responsive or not. Okay, so let's take this. I'm showing you this video. Let's see what happens in the video. So when the patient is responsive, like I said, you walk up to them and you ask them right out uh, if they need your help. You tell them your name, your training, and ask them if they need anything. If the patient is unresponsive, we need to make sure that this patient is unresponsive. If you're staying in a place like Mumbai, there are so many people who unfortunately do not have a place to stay. So you could find somebody who's homeless, who's staying around on the road, and your patient could be somebody who's just sleeping. So you need to first ascertain if this person is responsive or not responsive. So how do we do it? We use the method called shout, tap, and pinch. Okay, so this is how it goes. Okay, so what I did over here, if you can again, I'll show you for an unresponsive patient. Okay, for a responsive patient, I told them my name and my training. I asked if they needed my help. For an unresponsive patient, I shouted. I tapped loudly next to the patient to see if they are responding to the sound or the voice that I'm creating. If they do not respond to the sound or the voice that I'm creating, I go on to give them a painful stimulus. So I pinch the patient on the side of her neck to check if the patient responds to a painful stimulus. And if the patient does not respond to any of it, then I would term my patient as somebody who's unresponsive. Okay, so this is what it looks like. A patient who responds to voice or the sound is known as a patient who's at a level V. If the patient responds to pain, I would say the patient is at a level P. And a patient who does not respond to anything is somebody who's an unresponsive patient. Okay, so this is very important for us to ascertain. Once you've ascertained that your patient is unresponsive, the law clearly states that you have an implied consent to help the patient out. Okay, if while treating the patient does again become responsive, it is your duty to then ask the patient for consent. So if I'm working on a patient who's unresponsive, I have implied consent. And once I start working on him, if they wake up or if they regain their consciousness or they regain their responsiveness, then it is my job to ask them, sir or madam, do you need my help? I am Dhiren. I have been helping you with first aid for the last half an hour, 1 hour, 2 hours. Okay. But if they don't get up, we have implied consent. So the law says that if a person is not able to take care of themselves, you don't need to take their consent. You can start helping them by yourself. Now, in case of a motorcycle accident, what mostly happens is the patient that we see is wearing a helmet. Okay, and a lot of times people, I have seen so many times that people have stickers on their helmets which say that don't take my helmet off unless you are a professional medical, as in if you're a doctor, so only take off my helmet if you're a doctor. And there are various doctrines going around which say that taking off the helmet could be uh, hazardous to the rider or the victim. However, we need to look at it from a very practical point. Okay, if we have a patient who has their helmet on, it is difficult for the rescuer to ascertain if this patient is, as in mostly in case of an unresponsive patient, it is difficult for you to ascertain if this patient can breathe, if their airway is open, and all those things that could be life threats are something that you need to ascertain. Okay, so the helmet is something that would actually prevent you from ascertaining the wellness of this patient. The second thing is, I remember when I was in school, we had this story in our English language class, which was from airborne to chairborne. It was about an Air Force pilot who meets with an accident, a road accident on his bike or his two-wheeler. And when they're transporting him to the hospital, they have not taken off his helmet, and that helmet keeps on hitting the patient's neck and causes paraplegia in the person. The story was how the Air Force pilot then goes on and uh, makes sure that the paraplegia does not stop him from achieving his goals and all of that. And it was a very nice story. However, the incident wherein the first aiders in that story did not manage to secure this pilot's helmet caused the injury, as in made the injury worse, and this pilot was then rendered paraplegic, neck down. So this person could not move their hands or legs anymore below the neck. So I think today's skill that I'm going to now teach you is about how to safely take off a person's helmet. Okay, and it is a very nice skill. You should know this. It's not very difficult. We all know how to take off our own helmets. We are trying to do it the same for somebody who's injured, unresponsive, and we are going to try and minimize the uh, impact of getting this helmet out by supporting the patient's head and neck. So let's see. I have made a video. I'm going to show it to you now. So here, okay, we have a motorcycle accident victim, and me and my co-partner, as in my uh, co-rescuer, we are wearing our gloves. We have our basic BSI on, which we remember saying that number 3, not on me. So we have a BSI on, and now we are going to attempt to get the helmet off.
So when we have a person who's injured or has had a bike accident, how do we take off the helmet? Okay, so first this is a 2-person thing. So I'm going to first loosen the chin strap. Okay, open the visor to check if there are any glasses. If there are glasses, please take out those glasses. Okay, now I'm going to put my hands on the one hand on my patient's jaw and mandible, the other hand behind the patient's nape of the neck. And my second person is going to use these straps to stretch out the helmet and slowly pull it out. Okay, so first let me just get my hands in place. Okay, okay. Okay. Right. Okay, keep the helmet at the side, hold on to his head. Hold on to his head from both sides. Great. Now next, what we're going to do is put in the improvised soft collar, the Montana horse collar.
So till now, we just supported the patient's neck uh, on the back with my right hand and the patient's jaw from the front. So I kept on holding to that, which made the patient pretty stable while my co-rescuer helped take out the helmet. Now what I'm going to do next is use a Montana horse collar, okay, which is a improvised collar, soft collar for the patient. Okay, I'm using my jacket. I've rolled up the jacket. I'm going to use it to protect the patient's spine. Okay.
You keep your hands on the neck, on the head. Keep the head stable. That's what. You can get the head. And our patient now has a soft collar and the helmet is out.
So we saw that with an unresponsive patient, the first thing that we did was take off the helmet. By taking off the helmet, what we're doing is we now have, as rescuers, access to the patient's mouth, okay, so that we can see if the airway, okay, from where the patient is breathing is open. And that is very important. Even if a patient is a responsive patient who's talking to you, who's giving you information, the first thing that we do when we are checking our patient is to ask them to open their mouth and look inside and see if there's any kind of a foreign body that could obstruct the patient's airway. And why do we do this? Because if the patient's airway gets affected or jeopardized, then the patient can die in as short a time as 3 minutes. Okay, so the rule of the thumb, if a patient cannot breathe for 3 minutes, if they don't find a good shelter for 3 hours, if they don't drink water for 3 days, and if they don't have proper food for 3 weeks, then the patient can die. Okay, and 3 minutes is a very short time. We need to make sure that a patient can breathe and is going to stay alive till we take them to the hospital or to the definitive medical care, right? So it is very important that we have access to the patient's airway. So the first thing done, what we did was get the patient's helmet off, okay, and we used a soft collar to make sure that the patient's neck, okay, and the head is supported. I used a normal pig cap over here, okay. I just folded it and I put it under the patient's jaw, and I used a jacket, rolled up jacket, to make a basic collar, a soft collar for the patient. Uh, Next, what we need to do is we need to check if the patient can breathe. Okay, if the patient is having a clear airway. Now, how do you do that? There are two things. One is you look inside. Okay, you look inside the patient's mouth to see if you can see anything that is blocking the airway. Okay, you can always also hear what does breath sounds like. Now, the breath could sound like two things. One, it could be like completely silent and the patient has a proper patent airway and you can hear them breathe in and out. The second thing that could be is there is some kind of a disturbance or some kind of a sound coming from the patient's airway. So the saying goes, a noisy airway is a dangerous airway. Okay, if you can hear a noise, it's dangerous. What are the noises that you can hear? Number one, we can hear a snoring sound. A snoring sound like, okay, what does this sound indicate? It indicates that there is a solid which is blocking the airway or at least obstructing the airway. What is this solid? It's mostly the tongue which has fallen back on the airway, okay, while the patient is lying down, and that is the solid object which is actually partially or sometimes even majorly blocking the airway for the patient. There are some moves that we would do if the patient had not been a motorcycle accident victim. Okay, so in that case, we do a head tilt chin lift. However, because this patient has a suspected injury to their head or their spine, because a motorcycle accident involves high velocity, as well as this patient, the current patient that we saw is an unresponsive patient. So in that case, what we are going to do is we are going to log roll the patient, okay, onto their side, so that if there is anything in the airway, maybe a solid or maybe even liquid, okay, so if you're hearing gurgling sounds, we would just roll over the patient so that due to the gravity, whatever is there in their mouth, in their airway, gets out of the airway and the patient can start breathing again. Okay, so this is one of the first things that you need to do to make sure that your patient is going to stay alive till you at least take them to the doctor. Okay, I'm going to show you another skill. Okay, we have a okay, so we have some questions coming in, but I think yeah, so no, there are no questions. Sorry. So I'm going to show you another quick video to uh, show you how to turn a patient. Okay, so that will also be another skill that we are learning in today's session. Okay, so let's see where the session is, where the video is. Hold on. All right, so we have the video here. So in case we have a patient who's unresponsive and we know that this patient has had a high velocity accident, like from a motorcycle, or if you're hearing gurgling sounds from the patient, okay, then that means that there is liquid in the airway, or because this patient was somebody who was hurt on their head or spine. There's a suspected spine injury to this patient. We're going to roll this patient. How are you going to roll them? We're going to use the log roll method. So as you can see right now, I have taken the patient's hand, which was closest to me, straight up. All right, so you can see that hand goes straight up. Then the leg which was away from me, okay, I got it up. And now I'm going to hold the patient's nape of the neck, all right, and roll the patient over. Okay, so this is the position that your patient would finally come to. This is known as a recovery position. And till we actually learn more first aid skills, this is one of the best positions to keep your patient in till you can get more help. Okay, you may need to support the patient using some kind of a backpack or helmets or other thing, but this is one of the safest positions that you can have for your patient. Okay, so again, quickly to see how we do it. Okay, oops. So here, one hand of the patient is straight up. My hand, it looks like I'm trying to hold her shoulder, but it's on her head. Okay, just behind her head and neck. And my other hand is on the patient's knee. And what do? We do a log roll. Okay, great. So friends, what did we learn today? We learned two things. If our patient is unresponsive, we definitely need to understand that we have consent and implied consent by law to help these unresponsive patients out. If a patient is somebody who's in a motorcycle accident, please be careful, but you need to take the helmet off. Only when you take the helmet off will you have proper access to their airway, and therefore you will be able to keep their airway open. And third, what we learned was how to keep them in the recovery position. Okay, so we use a log roll, and in the log roll, you saw that we did not shake the patient's head or the spine. So the head and the spine rolled along with the patient, right? So that is what we need to do when we are looking at a unresponsive patient. And one more thing that we need to do absolutely with an unresponsive patient is call for an ambulance. Okay, so if you're on a site where you see an unresponsive patient, ascertain if they are unresponsive or no. Do a shout, tap, pinch. If you find out they're unresponsive, get their helmet off. Make sure that they have a patent airway and put them into recovery position. Okay, and definitely, you need to call an ambulance for an unresponsive patient, because these are people who have probably hurt their head or their spine or both. Okay, and this is serious, so you need them to be taken to a proper definitive medical care, or to a doctor or to a hospital very quickly. All right, so that was today's session about unresponsive patients. Abhishek, are there any questions? We have
Yeah,
about 50 left.
thanks Dhiren, thanks for this lovely short and quick session on unresponsive patient. uh, One thing that comes to my head as a question, would you be, so last time we spoke about the 5 steps to be sure, and sorry, we also spoke about how to be sure that you want to get into a situation to help someone, and learn the 5 easy steps that you explained last time in our first session.
Right.
Now when you get into a situation where you are actually down to help the accident victim, to me, Dhiren, while it looks very easy, when I see the video, and over a period of time, I keep seeing the video, I'll get to know it better. But do you recommend for anyone who's not really learned the actual uh, usage of this in some form of safety environment, let's say a training by you or someone else, to be actually doing this in live and what should one have, even if somebody's not taken a serious session about this, what should one do to be confident for doing something like this?
So it's a very long question, but the basic answer is that first aid, learning how to save somebody's life is a basic skill set that we should have. In fact, we do have a lot of things inculcated in us from childhood. Okay, and I do take training sessions. We have our basic lifesaver course, which is an online course which starts this Thursday. It's the 15th batch which starts this Thursday. So you can definitely contact us and get in the batch. It's a 4-day course and it is 2 hours every day. So 6:30 to 8:30 in the evening. The course will teach you basic life threats, the medical legal issues that you may want to know about, how to take care of life threats, how to take care of your patient, how to look at various injuries, various illnesses. So you learn a lot in such courses. It is absolutely necessary that all of us take some kind of a formal training. And it's not just because you may find somebody on the street who you need to help out. Uh, Unfortunately, it could also mean that, as in not unfortunately, like for example, at my place, okay, I know how to do first aid, and I have been practicing doing first aid on various patients as well as students in a classroom setting or in a outdoor setting, and practice is something that has helped me as in actually perfect my skill sets. Okay, so you should definitely take up a class. It makes sense. You can help out not only outside but at home as well. At my place, my younger sister, my sister, my wife, my mom, they all have done a first aid course. Okay, so I'm sure that in case something goes wrong with me, I have somebody who can help me out. Okay, it's not always you who's going to be the one who's going to be rescuing. So it's a good idea to learn these first aid skills. There are many courses that happen in Mumbai, in India. Okay, there are some international courses as well which have validity all over the world. So you can look at those as well. There's Hannafil Center in Missouri which does some courses with Erie Backcountry Medicine, which is a US based uh, institute, and I teach with them. I teach wilderness first aid classes for Hannafil Center. There is also Knowles, which is based in Ranikhet. So they both have 3 courses mainly. First is the 3-day, 2.5-day wilderness first aid course. Then there is a 4-day wilderness advanced first aid course. And then there's a 9-day wilderness first responder. So my training is wilderness first responder, and I re-certify myself, as in I go and do these trainings every 2 years to keep my certification current. So, and once you start doing these courses, you'll see that a lot of it is uh, sort of common sense. Okay, like for example, when you're eating something and a morsel goes inside your windpipe and you start coughing, my mom always used to say, "Look up, look up." Okay, when I was a kid, and now I know, like by looking up, what am I doing is I'm opening up my airway. Okay, or when say for example, somebody faints. Okay, people start laying them down on the ground, or I remember somebody fainted in my dad's office a few years ago, and by the time I reached there to check out what the condition was, they had managed to lay her down properly, that lady, and when she came back to her senses, they had offered her some sugary drinks. So offering sugary drinks is a good thing, because when the brain needs sugar. So offering sugary drinks is something, and all of these things were done by people who have not done first aid at all. So why not do a first aid training and know exactly why you're doing certain things? Okay, it makes a lot of sense, Abhishek. If you learn a as in if you join a first aid course, it will definitely help you out with your skills, and it will help you out at home as well.
Thanks, Dhiren. That was a long answer for the long question.
Sorry.
So, coming to the other question from one of the videos where you spoke about turning the patient, or the log roll that you mentioned. Now, in a situation where you don't see an injury on the outside, and before the log roll, you mentioned that safely remove the helmet by two people coming to the spot. What and how can one understand uh, where the injury is? How, if the patient is responsive, yes, the patient would be able to tell you. But if the patient is not responsive, in that situation, you have two types of injuries. One could be external, where you can see where the injury is. One could be internal, where you can't see. And if a patient is unresponsive in that situation, how do you know which side to roll? So, what's the answer for that?
Mm, So I would say look at it in a fashion. If you're thinking about, say, if the patient is hurt on this hand and you roll that patient on that hand, would it be painful for the patient? Is that the general thing that we're looking
Yeah, yeah. So I don't know where, somebody's got hurt, and I'm trying to help with knowledge and experience that I gain after doing the safety sessions. Or how do I know, am I doing it correct in a internal injury
for?
perspective?
So let's look at it this way. Uh, is that other injury, this whatever internal injury that we may have or not have found out, or this hand or uh, leg injury that they might have that we have not yet found out, is that going to kill the patient in the next 2 3 minutes?
I wouldn't know, Dhiren. Dhiren, I am also
No.
learning the
What
ropes
is
as we
what is
go
going
through
to
these
kill them?
sessions.
What is going to kill them is them not being able to breathe. Okay, and that's going to be like fast. Okay, next 2 minutes, if the patient can't breathe, 3 minutes the patient can't breathe, then the patient is dead,
Okay.
and we can't do much about it. Okay, and the log roll that we are doing it early on in the entire patient assessment system. Why? Because that way we are sure that the patient's airway is open. The patient is not going to die because the airway was blocked. Okay, so it's a life-saving move that we are doing. All right, and when you do a course, you are going to learn that yes, why this is more important than first trying to see if there are any other injuries on the patient. Okay, a broken hand, okay, will not kill the patient unless of course there's like a large bleed happening from the broken hand. Then yes, you need to stop that bleed as well, and we'll talk about these in the future sessions. But the way the actual, like in scene survey or the scene size up class that we did last week, we had number one, I'm number one, number two, what happened to you, number three, not on me, number four, are there any more, and number five, what's the why. Okay, same way, when we start our primary assessment of the patient, primary survey of the patient, we are looking for life threats, and we go in the order of airway, breathing, circulation, neurological deficit, D, and environmental threats. So A, B, C, D, E. We are looking at it in that way, and once we have eliminated all the life threats, only then do we go and do a more in-depth assessment of the patient to see if there are any other injuries that the patient has. Okay, but number one is we need to keep the patient alive. If we don't keep the patient alive, then no matter how much care we take of the other injuries that are there, the patient will not be alive to enjoy that. Okay, so maybe there'll be a little pain because you roll them on the side which is injured. Okay, but they'll still be alive. So that is the entire the crux
Thanks.
of the matter.
Thanks, Dhiren. Dhiren, another question that comes to mind is, typically, if it's an unresponsive patient, do you see a lot of people suggesting, let's give water, let's see, if the person drinks water, or some form of water support is provided? When I say some form of water support is not the evening
Everybody's
water support.
trying to get
Yeah.
water to an unresponsive person or to anybody. People think that it is great to give water. I once asked a person also, like, why do you go ahead and try to give water to people when they are injured? And they are like, मरते आदमी को पानी देना चाहिए. As in, just a joke that man made. But the point is, water, like we said, we discussed the rule of three. 3 minutes without breathing, and the patient will die. 3 hours without shelter, that is, if you're in an extreme condition where you are in the sun, or if you're in uh, the snow, or if you're in like really pouring rain, 3 hours without shelter. Shelter includes your clothes also. Okay, protective clothing is also shelter. 3 hours exposed to the elements, and the patient can die. 3 days without water, and the patient will die. Now, if you look at the 3 minutes without air and 3 days without water, okay, the 3 minutes without air makes more sense. I want to make sure that my patient is breathing in the next 3 minutes at least, or make sure that they are not, uh, their airway is not blocked for that long. And if I try to put water inside my patient's unresponsive patient's mouth, okay, what am I doing? I am now breaking my rule, okay, the rule of keeping the airway open. This is a person who's unresponsive. They cannot take care of themselves. That's why legally you have an implied consent from this patient. Now, if I put in water in their mouth, hoping that they'll drink it, that water is most probably going to choke the patient, and the patient won't be able to breathe. And now you will be the cause of their death, not that motorcycle accident. Okay, so I would say, even though you are trying to help somebody by giving water, restrain yourself. Okay, the patient can go without water for a good 3 days. Okay, does not mean that we want to not give them water for the next 3 days. But if they are unresponsive, that is not your priority. Your priority is to keep the airway clear. So airway, don't put any water inside the patient's airway, because that is going to cause a problem. I hope that answers the question.
Yeah, thanks, Dhiren. One last question. You mentioned a couple of times about legality, and that's a very practical situation in India where people are scared about, what will happen. Cops will question me a lot, so I want to stay away, from situations like these. You did mention that it, with the actions, the three actions that you mentioned about shout, tap, and pinch, uh, there is an implied uh, acceptance by the patient is as per law. Now, what would you say that a person who's helping is not to be or will be questioned, or
So
should
what
not
we
get
can
scared
do,
about?
Abhishek, is we can hold a full session on the medical legal issues. Okay, it's a short topic, but it's something that people should know. In India, there are laws which actually say that the police cannot trouble you if you're trying to help somebody. The laws have been made so that it encourages people to help out accident victims, okay, or anybody who's injured. So we do have laws that will protect the rescuer. So, but let's have a fresh session for that, and we'll just go into a lot of details so that people know exactly how they are safe.
So, Dhiren, thanks for these questions and your patient answering of them. Today's session was informative. We heard about uh, the actions to be taken to ensure that at the scene whether the patient is responsive, to take their permission to help them out, or if the patient is unresponsive, then the three steps that you mentioned: shout, tap, and pinch, uh, to be able to have an implied uh, confirmation
Consent.
from, consent, for taking those next steps that you mentioned, which is how to remove or how to safely remove helmet, uh, how to log roll the patient, and breathing as the key aspect, which will otherwise, you know,
To keep
take
the airway
to keep
open.
the patient alive, because 3 minutes of breathing is more critical than giving water or attending to injury. So that's very important as a thought process. What do you think will be our next session? Because there'll be some legalities. Why should I help? Cops will chase me. What do you think we should do
So next
around that?
session that we are doing, we'll be talking about a little bit of the medical and legal aspects of this safety thing. We need to know what are our rights. We need to know what are our duties towards the patient that we are going to rescue, and how there are some Indian laws that have been made which ensure that people are encouraged to help people, and there are some leeways that a rescuer gets because they are a good Samaritan. So next week, let's do this session on the legal aspects of a rescue. Okay.
Great. That sounds good. Thank you again, Dhiren, for being here, doing this session with Jumpstart Outdoors and supported by Roaring Cycles and Let's Ride. This is a free session. You will get a video to watch of this session if you have missed today's episode on Jumpstart Outdoors, Roaring Cycles, and Let's Ride YouTube channels, and they go by that same name. Dhiren, thank you again, and we will see you again next Sunday, 5
Thank you,
p.m.
Abhishek. Thank you, guys, and we'll meet on the next session. So bye bye.